Hello, I'm Harvey Godwin Jr., Chairman of the Lumbee Tribe, and today we are here at UNC Health Southeastern. I'm here with tribal member and health professional Dr. Joe Roberts, who is the Vice President and CMO here at UNC Health. He is a great friend to the Lumbee and has helped us on many occasions improving our health and maintaining our health and saving lives amongst our people. Dr. Joe Roberts, it's a pleasure to be here with you today.
Hello, my name is Joseph Roberts. I'm the Vice President and CMO at UNC Health. So happy that the Tribal Chairman has come to UNC Health Southeastern to talk about vaccinations. I want to thank him for all the work that he's done with various groups, including CORE, UNCP, UNC Health Southeastern, and the Health Department. I do have some good news today. There has been a lot of information about Robeson County and our lack of vaccinations. As of yesterday, we actually passed 2 other counties in the state, so we are no longer the least vaccinated county in the state. Again, I want to thank the chairman for all the work that he's done and the videos that he has done with the pastors and preachers. I want to thank him for the work that he's done with the healthcare providers, and I suspect that a lot of the increases that we've seen in vaccination rates are due to his persistence in this matter. At UNC Health, we reached our peak of hospitalizations for COVID patients approximately August 29th. At that time, we had approximately 60 COVID positive patients in the hospital. Today, I'm proud to report that we have 25. I would also like to say that during this time of COVID hospitalizations, unvaccinated patients make up anywhere from 92 to 98% of the patients that are hospitalized. And I'd also like to say that we have had very few vaccinated patients admitted to our ICU or that have died. Today, I have the pleasure of having 2 colleagues from UNC Health Southeastern. I have Dr. Okoye, who is our infectious disease specialist. I'd like to say that he has been instrumental in our COVID care at Southeastern. He was the first person to get the COVID-19 vaccine in Robeson County. And I suspect that he has probably taken care of more COVID patients in the state than any other provider. We also have Jordan Deese, who is a registered nurse who works in our ICU. And between the 2, I've asked them to give their personal information, experiences with COVID patients. And I think it'll be very enlightening for the public. Thank you.
Good morning. My name is Dr. Obiefuna Okoye. I am Medical Director for Infectious Diseases at UNC Health Southeastern. Today, I really want to talk about COVID-19 vaccination, and the way I want to talk about it will be from the perspective of what I am seeing in the hospital. We have heard a lot about COVID-19 vaccination. There's a lot out there that has been said, but I just want to share our experiences in terms of the patients we are seeing here in the hospital. So we know that this vaccine that was initially granted emergency use authorization in December 2019, we have 3 current vaccines that are being used now. We have the Pfizer vaccine, which has been fully approved by the FDA. We have the Moderna vaccine and the Johnson & Johnson vaccine. So patients have been getting this vaccination as of December 2019 up until now. We are still having some skeptics about the efficacy of this vaccine and also about side effects from this vaccine. So what we are seeing right now in the hospital, we have just had a recent surge of COVID-19 patients majority of these patients are unvaccinated, meaning they have not received any of these vaccines. In terms of the severity of the illness that we are seeing these unvaccinated patients with very severe illnesses. These patients end up in the ICU. As of this morning, I have 6 or 7 patients in the ICU, and none of them are vaccinated. They are all on the ventilator. So this is a marker of severe illness, and none of them are vaccinated. In the hospital this morning, we have approximately about 25 patients, and none are vaccinated. So in terms of the patients we are seeing in the hospital, 97 to 98% of these patients are not vaccinated. Their illnesses range from moderate to very severe. And this is also reflected in the duration that these patients are spending in the hospital. Also reflected in the number of deaths we are seeing as a result of COVID-19. For instance, the month of August, we tallied our number of deaths from COVID-19. We had a total of 34 patients who died, and just 2 were vaccinated. So about 32 of our patients who died from COVID-19 in August were not vaccinated. Also, we are seeing that these patients are spending longer time in getting better. I have a patient I was talking to yesterday morning, and as she was struggling to breathe, she told me, "This is really very bad. Why didn't I take this vaccine?" She has been in the hospital for 3 weeks now. She so dearly wants to go home, but she is still on a lot of oxygen. And she realized that if she had taken this vaccine, she probably will not have been spending all this time in the hospital on a lot of oxygen. Also, patients that are vaccinated that I see in the hospital, they spend an average of 2 to 3 days in the hospital. They do not end up in the ICU. They do not end up on the ventilator. Even if they end up in the ICU on the ventilator, I recall one lady who's vaccinated. She spent 2 days on the ventilator. She was extubated, and she went home back on her oxygen. But the patients who do not take the vaccine, they are spending, I have a gentleman who just died this morning. He spent 40 days in the ICU. I have another patient who is a very young lady. She's 35 years old. She has spent 30 days in the hospital, and she just ended up on the ventilator. She's not vaccinated, and we are not sure she is going to come off that ventilator. So in terms of all categories, if you look at in terms of death, the unvaccinated are dying more. If you look at in terms of severity of the illness, the unvaccinated have more severe illness. If you look at recovery, the unvaccinated are taking longer to recover. And even at times when they recover and go home, they still come back to the hospital and still have to end up going to a rehabilitation facility or spend longer time in the hospital. In terms of also on the effect on us healthcare workers, it is becoming very depressing. Most of us are broken. Most of us are struggling even at home because we can't continue to deal with this number of sick people who are dying despite everything we put in to save these patients. I always share one story of 2 brothers that I took care of sometime in August of this year. One of them was vaccinated, the other was not vaccinated. They lived in the same house. The 2 of them were admitted in this hospital, and you can imagine that the one who was not unvaccinated, the one who was unvaccinated died, and the other one who was vaccinated spent 5 days in the hospital. As he was about to go home, he kept crying and said, "Why didn't I take my brother to go and get this vaccine?" So these things are real. So we are seeing this every day, and we healthcare workers have been pleading with patients to please take these vaccines so that we can reduce this toll on our healthcare system, on our healthcare workers. At some point in time, in some of the hospitals, they don't even have rooms to admit these patients. Some of the medications we use to treat these patients, we have to prioritize, we have to ration. Sometimes we don't even know when we are going to get these medications. So, as I discuss with some of my healthcare colleagues, as we continue to plead, some of them have told me to pass this message on, that if they could take these vaccines for us all, for you all, they will do it, but they can't do it. They are pleading that you please take these vaccines so that things can start to get back to normal, that healthcare workers can get back to doing what they know best to do, take care of patients, not just COVID-19 patients who are very sick. So in summary, as I have said, vaccination makes difference. One, it prevents you from getting this infection, but even if you get the infection, you are likely to have a mild form of the infection. You're unlikely to spread this infection. You're unlikely to end up in the hospital with this infection. Even if you end up in the hospital, you are unlikely to have severe disease, end up in the ICU, end up in the ventilator. Even if that happens, you're also unlikely to die from this virus. Thank you very much.
Hi, my name is Jordan Deese. I am a registered nurse in the intensive care unit here at UNC Health Southeastern. I have been working as a nurse for all of the pandemic. Since the beginning of the pandemic, our hospital, and like hospitals across the nation, and specifically our ICU, has been flooded with COVID patients. This morning, we have 25 COVID patients in the hospital, 8 of which are sick enough to be in our intensive care unit. 6 of those 8 are sick enough to be on what some people refer to as life support, which is they are on a ventilator, breathing for them. It's hard a lot of times because being a member of the community, I'll read about patients on Facebook before I even get to work because I know their brother, their mom, or whoever, and they're posting, please pray for my whoever, please pray for my son, please pray for my mom. And then I get to work and I see them and I take care of them, and it's heartbreaking. And then you call and get the family updates, and you know they know you, they know your name, they know your voice, they put 2 and 2 together, and then the patient dies or they have a bad outcome, and you see it on Facebook. It's hard, it's heartbreaking. Our ICU nurses have been through the unimaginable since the beginning of COVID. It's been extremely stressful between our ICU nurses, between our amazing respiratory therapists, our intensivists, our residents. We wouldn't be able to make it through a shift without the teamwork that goes on in our ICU. It is incomparable to, my previous jobs. In my experience, I have only encountered 2 vaccinated COVID patients in our ICU out of the hundreds of unvaccinated COVID patients that we have encountered. And of those 2, both of them were able to make it out of our ICU, be transferred to our step-down unit. For so many of our unvaccinated patients, the same has not been true. A lot of them have died with COVID, have died on the ventilator. So I want to take this opportunity to please encourage you to reach out to your local healthcare professionals, reach out to your primary care physician. We want to encourage you to get the vaccine. It is our best resource for preventing severe COVID-19.
This shot is your shield.